All right, so welcome everyone. I'm Ryan Molloy, managing editor of the Senior List, and today I'm speaking with our co-founder, Amie Clark, about all things related to paying for assisted living. Welcome, Amie.
Hi, thanks, Ryan.
All right, so let's dive in. So pretty basic, but to get started, what exactly is assisted living?
So, assisted living is one of the levels of senior housing that exists throughout the US. Assisted living is typically in an apartment style type of living for people who are independent in many ways, but also may need some support services, whether that's help with grooming, bathing, medication management. There's a variety of services that can be provided in assisted living while supporting people to be as independent as possible. Generally, people in assisted living, enjoy communal options such as communal dining, activities outside of the building, outings, that kind of thing.
Great. And so I know this is something that my grandparents are currently thinking about. The real question, how much does assisted living cost?
Yeah, and it's a real loaded question because it can range so much based on location. Even in the same location, two facilities side by side can vary greatly, just depending on the size of the building, the amenities that are offered. So in general, and I had to look this up, depending on where you are in the US, costs can range anywhere from $3,500 to $7,000 a month. So the median cost of assisted living in 2020 was $4,300 a month.
And so sort of piggybacking off of that, you touched on how the different levels of amenities can affect the cost. What about couples? How much does assisted living cost for couples generally?
Also a very loaded question. Facilities may charge for couples very differently across the board, so it can be hard to compare apples to apples. The first thing to consider, and not just couples, but individuals as well, is that there's always going to be the base cost, which is also known as the room and board. So there's always going to be this number for the apartment that may include some things like laundry and housekeeping. So we'll just call that the base rent. So that's the cost of the apartment. So for couples, if generally they're looking at a larger 1-bedroom or a 2-bedroom apartment, that just the base cost alone for that size of apartment can range from $4,000 to $6,000 a month. Mm-hmm. On top of that, just like an individual person, each person of the couple is going to have their own care plan. So each of them is going to be charged individually for the services that they require. Now, of course, if someone is completely independent, which happens, one spouse needs help or a lot of help, and then the other spouse is completely independent. So depending on the care needs of those two people, all those costs will be wrapped up into one. So for a couple, realistically, let's just say one person is quite independent and the other person needs, quite a bit of help. Mm-hmm. For a couple, it could range anywhere from $5,000 to $10,000 a month. Again, that's a huge range of money, I know. But it really just depends on all of those different factors.
Okay, great. Yeah, so it seems like it just kind of varies a lot, mostly by location and the type of care given.
Yeah, I always recommend to people, and of course, this may also be impacted by how much time you have and, what else is going on in that moment, if it's crisis driven or if this is more of a pre-planning step, looking at different facilities, but really, look at as many different facilities as possible in order to get a good idea of the range of those costs that are available.
Okay, great. So let's go, maybe this is a little bit less loaded. So just more broadly speaking, according to Genworth's cost of care survey, assisted living costs have increased over 70% since 2004. Could you maybe give us some insight about what has caused such a big hike in the price?
Yeah, that's such a huge leap. We always tell people expect anywhere from 3 to 6% each year for your cost to increase. However, that doesn't add up for the 70% that we've seen since 2004. But there are a number of factors that have led to that increase. One of them is, attributed to the huge caregiving crisis that, healthcare in general is experiencing, but especially in long-term care. There just aren't enough people working in the field. So that leads to higher competition for quality staff. It leads to higher wages that are being demanded by caregivers themselves. So that in turn will lead to a rise in costs. The other factor that I've seen personally, just, over the 20 years or longer that I've been working in long-term care, people, the residents themselves are coming into these communities needing more help than they used to. The acuity that we're seeing in assisted living specifically is much higher than it used to be. We're seeing a lot more, Alzheimer's and dementia related diagnoses on top of, other chronic conditions. So you have to have staff that are more specialized, that are more knowledgeable as to how to deal with people that have, behavior issues and all of the things that are going along with higher acuity people. People are staying at home longer. They're staying at home as long as they can. And I think that's just leading this trend of people just not entering this level of care until, much later in their aging journey than they used to. And specifically in 2020, I think we saw some rising costs because facilities had to pay for PPE for, residents and staff. That's a huge expense. Plus, there were some changes in the guidelines, CDC guidelines, as well as some other federal guidelines that changed for facilities across the US. So all of that combined, I think, is part of why we've seen such a drastic increase in costs.
Yeah, COVID's definitely not helping things there.
No, not at all, for sure.
Okay, so on the note of paying for assisted living, does Medicare cover assisted living in any capacity?
Medicare does not cover assisted living. The only thing that Medicare would pay for in assisted living is an outside skilled service like physical therapy or occupational therapy. But it's for, it's a short period of time, and it's just for those specific skilled services through a home health agency.
Okay. And what about Medicaid? Will that cover assisted living?
Yeah, so Medicaid, yes, as long as someone qualifies for Medicaid. And I'm sure we'll link to the video in the description, but we've done past videos about Medicaid and who qualifies for that and what things it does cover. But just in a very general yes or no answer, yes, Medicaid will cover assisted living.
Fabulous. And just going down the line of all these different funds, what about VA? Will VA benefits pay for assisted living?
Yeah, so the VA does not pay directly for assisted living, but there are probably the most widely known VA program is aid and attendance. It's a pension for veterans and their spouses. And aid and attendance will pay for services that the veteran or their spouse may need. So that can include services in the home, assisted living, modifications to the home, a variety of long-term care services. For example, my own grandmother, who was a widow of a veteran, she received, it was a little over $1,000 a month from the aid and attendance program to help pay for her assisted living costs.
Gotcha. And then next, would assisted living be tax deductible?
So this is a great question, and I actually had to do some research on my own because I wasn't sure. But yes, assisted living as a medical expense can be tax deductible. So just depending on your income and the expense itself, and I'm going to quote this just because I don't want to get it wrong. So some or all of the costs of assisted living may be tax deductible as a medical expense. Medical expenses, including some long-term care expenses, are deductible if the expenses are more than 7.5% of your adjusted gross income. So my advice to anybody who is wondering this for themselves would be to consult with a CPA specifically about their situation and the costs that have been incurred through assisted living.
And it sounds like, though, based on if it's 7.5% of your adjusted gross income, then a lot of people would qualify to deduct that.
Absolutely. Yeah. And there were also some, when I was looking at the IRS website, there were also some things that said, depending on how the assisted living classifies your medical expenses, that custodial care wasn't necessarily covered, but medical expenses were. So some of it may have to do a little bit with the logistics of the assisted living and how they classify certain things. So it sounds like it potentially could be complicated or potentially not be complicated, just depending on someone's circumstances.
Gotcha. Yeah. And about how all those expenses are classified.
Yeah.
All right. And so it sounds like you have much experience with this. How do most people pay for assisted living?
So most people, again, as a general statement, pay for assisted living privately out of their own pocket. Of course, people who have planned ahead and purchased something like long-term care insurance, they're, according to whatever their policy is, that long-term care insurance would be paying for assisted living. But I think in terms of most people are going to start out paying privately out of pocket. Now, of course, for many people, that is not going to be a good long-term solution. They may not have the finances to support paying out of pocket long-term.
Yes.
So then Medicaid is an example of a program that would kick in once somebody no longer has the finances to pay privately out of pocket.
Gotcha. Yeah, I know that's one of my grandparents' biggest fears, going to assisted living, running out of money, and then just getting like booted into a nursing home, as they would say.
Yeah. So, and I'll touch on that type of scenario, I think, with the next thing that we'll discuss. But there are some ways to avoid that for sure.
Okay, great.
Yeah. But it is a major concern. And it, unfortunately, it's not something that a lot of people really think about until they really are starting to get towards the, eventual reality that they're going to need some sort of long-term care.
Definitely. It seems like planning ahead is really essential in all of these instances.
Yep.
And so what are some of the tips you have for affording assisted living?
Yeah. And you led me right into the answer, planning ahead. I would, I would have to advise anyone, especially people, even in their 40s, 50s, the statistic is 70 to 75% of people will need some form of long-term care in their lifetime. So that might just be services at home, but that, could be all the way up into a nursing home level of care. So given that most of us will need some form of long-term care, it's so important for people to pre-plan and to think about this and to think about those costs in their retirement. When people are trying to figure out how much they'll need to retire, long-term care and medical expenses is one of the biggest costs that people will probably have to shell out. So that's my first, blanket statement about that.
Yeah, of course.
If a person like your grandparents are concerned about running out of money, my first piece of advice would be to make sure that the community that they're moving into or that they're looking at has a Medicaid contract, so that when they do run out of money and qualify for Medicaid, they can stay there.
So not all assisted living facilities do take Medicaid.
Correct. Yeah, they have the choice whether to accept Medicaid residents or to keep people who have gone through their money in the facility under a Medicaid contract. So there's some pretty strict rules surrounding Medicaid. If a community has a Medicaid contract in place, they cannot make someone leave if they run out of money, as long as they qualify for Medicaid.
Yes.
So they cannot kick somebody out based on a change in their financial status. So as long as your grandparents move into a place with a Medicaid contract, they should be fine, given everything else is the same, that they haven't, grown out of the actual services that are offered, that their care doesn't exceed, what can be provided, but they cannot be booted for a change in their financial status. So to answer that question.
All right.
Another tip I would say for people who are looking to save a little bit of money, so to speak, is that of course a smaller apartment is going to cost less than a larger one. So I've seen plenty of scenarios where people start out in a 1-bedroom and then as time goes on, realize they just don't necessarily need the space, or they'd rather cut the expense of that 1-bedroom, move into a studio apartment. So I would recommend for people that are currently in assisted living, looking to save on some of their costs, talk with the marketing team. Those are the people that usually have, a good idea of what apartments are available or apartments that are coming up, to see if they can transition into a smaller apartment. Another interesting concept that I personally have not seen much of, but I know it's out there, is people who apartment share in assisted living. So if you can find someone that you're compatible with, sharing even a 2-bedroom apartment would greatly reduce that, high cost of room and board in assisted living. I would tell people to make sure they understand the fees that are charged in assisted living, especially upon move-in. There's the move-in fees can range from something very minor to some really high fees, which are sometimes negotiable. Think about it like a car dealership in the sense that salespeople have a quota that they have to meet. And every month, towards the end of the month, there's a good chance that you'll see some deals, whether it's a reduction in the move-in fees or complete elimination of move-in fees, or even a reduction in the room and board, the actual cost, if they're running a special to try to get people to move in.
Yeah.
I like to tell people sometimes those can be negotiable. Do not hesitate to ask, and let the team, let them know, the people that you're working with when you're touring facilities, that, you're really interested in saving some money, and what can they do to help encourage you to move in and spend a little bit less money at the facility.
So it sounds like there's sometimes a bit of room for haggling.
Yes,
potentially.
Absolutely. Yeah.
Okay.
Yeah. And lastly, I would say for people who already are in assisted living, make sure that you are monitoring that monthly bill every single month. And if you see anything that looks off, if you see something that's being, that has a higher cost than it did last month, talk immediately with the billing department about that. Just make sure you're staying in communication with billing, with even administration, and letting them know that you're concerned about the costs. Sometimes facilities will have leeway depending on their parent company, depending on their vacancy rates. They may have leeway to reduce rent for people who are concerned about money, just in order to keep them in the building. It's less costly for them to do that than to start brand new with a whole nother person and filling the room and the marketing that goes into that, and all of the things. So, again, just don't hesitate to ask and stay in communication with the people at the facility, the administration at the facility.
Okay, great. So make sure you understand all those charges.
Yeah, absolutely.
So that does it for questions about paying for assisted living. Thank you so much for joining me, Amie.
You're welcome. Thanks for having me, and looking forward to our next video.
Thank you, everyone. And be sure to check us out on theseniorlist.com for all things related to thriving in place. Have a good one, y'all.